One of the most important things that we know when we work with our physician partners is that leadership is a key and essential ingredient. I will tell you that we have been so happy with the leadership of Sheridan. They have done a terrific job of making sure that their goals are aligned with our goals and that we meet that top 10% in patient safety and quality. If I were talking to other chief executives throughout the country, the first thing I would tell them is your organization aligned? You're really focusing on what's important both today in the current healthcare environment and for the future under the Affordable Care Act. And one of the things that you need to do is make sure your organization is aligned first. Once that happens, you can begin to look for partners who will really focus on really meeting your objectives in your organization. I can think of nobody who has been better than Sheridan in doing that.
Any organization's first got to look at themselves and see who they are and what their mission is. Our mission is to enhance life of our patients every day, to enhance life for our community. So I think a hospital, an organization has to look at that first. Then they know who to partner with. From our perspective, we were able to partner with Sheridan very easily because they have the same mission. They want to enhance life too. Their mission is to make things better for the community that they serve. And from a chief medical officer's point of view, it's a very easy working relationship because our communication lines are open in both directions. If I have an issue, I can speak to my chair of anesthesia. I can speak to the chair of corporate anesthesia. Likewise, if they have issues, they can reach out to me 24/7.
When you look for a partner, you have to look for a partner who is engaged with what you're trying to accomplish at your hospital. So when we looked at our physician partners who were contracted physicians within our hospital, we looked for people who had the same culture that we do. And it was really focused on those four top priorities: safety, quality, certainly patient engagement, and the economic health of the organization.
I am still a practicing physician, and I'm very proud of that. I'm a surgeon, and I wind up in the operating room several times a week. And so for me, the proper functioning of an operating room is very, very important. Working with Sheridan and the leadership that Sheridan has provided in the OR, we now have an efficient operating room. We've grown our surgical services from a few hundred cases to over 800 cases a month, which is phenomenal. And not only the number of cases, but the complexity of the cases. And that has enabled us to become much more productive, much more profitable, but we're also very efficient. And we have done it in a very collegial and collaborative way. And I give a lot of that credit to the leadership from Sheridan.